Athletic training is defined as a certified and licensed healthcare professional who practices in the field of sports medicine. To further understand that definition of athletic training, it's important to understand the definition of sports medicine. And sports medicine is a branch of the medicine that deals with physical fitness and the treatment and prevention of injuries related to sports and exercise. So 3 things that are going to be discussed in this speech is 1, really just how not to confuse an athletic trainer with a physical therapist, and they're pretty similar, but there are some major differences. 2, how to become an athletic trainer, some simple things, but things that also take some time. And 3, pretty short, but where athletic trainers work at. So the main difference between athletic trainers and physical therapists are the responsibilities between the two, and that's like how they differ in their job settings. So the job responsibilities of an athletic trainer is preparing athletes for practices and competition, quick assessments of injuries, implementing strategies to prevent the injuries, such as wearing a knee brace or any kind of brace on the body, documenting injuries and treatment plans. And documenting those injuries and treatment plans are really important for an athletic trainer just due to all the medical things that they deal with. So just in case something does happen with one of their athletes, they have documentation proving the things that they have done with the athletes and for like any kind of injury that they have. And then lastly is preparing an appropriate treatment plan for athletes who are injured. The job responsibilities of a physical therapist really determine the patient's condition, monitor the patient's movements to help identify mobility issues, which is a really big one for physical therapists versus athletic trainers. 3, preparing a treatment plan for that patient, teaching the patient's exercises on a day-to-day basis, and monitoring and documenting their patient's progress, which is also really big for a physical therapist as it is for an athletic trainer. Some other differences between athletic trainers and physical therapists are the different degrees that they need. So for an athletic trainer, you would start off as like a 4 years bachelor degree at an accredited undergraduate program, which is what I'm currently doing. And a physical therapist would have to do that, but then also get a doctorate to become a physical therapist. So they're a little bit higher level of a degree that they need to become that profession. The ages they work with, so athletic trainers work with mainly collegiate athletes or really just the ages between middle school to college athletes, whereas physical therapists deal with, babies to all the way up to elderly individuals. And then 3, the location of the job setting. So athletic trainers primarily work like inside in their office. So if they have like kids who come to them to get like treatment, help with anything like that, they'll be inside for that. But then they'll also take their job outside. So they're kind of like bounce in and outside. And most of the time when they're outside, like during a sports season, so like right now you have baseball, softball, track and field, sometimes basketball and wrestling. So they'll actually carry a walkie-talkie with them so that they can be able to bounce from place to place so like their athletes can always have someone on call. And then also the hours worked of the day. A physical therapist would mainly stay inside. Obviously, they work in a more of like a hospital setting, and they would work from like the basic 8 to 5 job. And an athletic trainer would probably come in around lunchtime, around 12, and stay till the sporting events are done. So whether that be a practice or a game setting. So how to become an athletic trainer. So you must obtain a bachelor's degree and at an accredited program. So at Southern Wesleyan University, we have an accredited exercise science program, but that is not enough just to become an athletic trainer afterwards. You also have to pass the Board of Certification exam, also known as the BOC. And a little background information on the BOC. It was incorporated in 1989 to provide a certification program for entry-level athletic trainers, which is needed for all athletic trainers, whether that be middle school, high school, college, universities. And it reviews both the standards for the practice of ATs as well as the continuing educational requirements. And this is important because a BOC is the only accredited certification program that is offered for athletic trainers in the U.S. And then lastly, they have to be able to practice in the state that you live in. So you have to be accredited in that state and get your credentials for that state. So if I were to work in South Carolina, I would need to be accredited in that state versus if I were to get my BOC here, I would need to also take another state exam in another state if I were to end up moving. And lastly, where do athletic trainers work? So they're mainly in educational settings. You can find them in hospitals, but it's not very big. But those educational settings include middle schools, high schools, colleges and universities, and also the Army. And the Army also has different program requirements, but that is an option if you are looking to be enlisted and also serving as an athletic trainer. And lastly, to wrap things up, athletic trainers are healthcare personnel who are specifically trained to help diagnose, treat, and prevent sports injuries in various settings. Their involvement in school sports and the care of athletes is evidence-based to improve outcomes in general of the athlete's performance. Thank you.